changing priorities for health and healthcare, especially in these tough times, have profound implications for the way nurses and midwives practice, the shape of teams and services, and many aspects of management, education and development. The renewed focus on high-quality care puts nurses and midwives in pole position to improve health outcomes, the quality of care and the experiences of service users. On the 2nd of March 2010, the Commission delivered its report to the Prime Minister.
It has been my privilege to chair the Commission, which you established in March 2009, to explore how the nursing and midwifery professions could take a central role in the design and delivery of 21st century services. I say to you, Prime Minister, I am delighted to commend this to you, and I am so pleased and proud that you asked us to be on the front line of care.
The Prime Minister asked the Commission to consider how best to put nurses and midwives right at the heart of delivering high-quality, compassionate care, and to identify the challenges they face and the opportunities open to them.
Can I say, first of all, that this is a great day for nursing, it's a great day for the health service, and it's a great day for Britain. And I believe that this report that has been done by the Nursing Commission will influence the development not just of nursing, but not just of the health service, but the development of the way that we see all our public services in the future.
The report sets out a vision for the future of nursing and midwifery and proposes achievable next steps towards it, making a compelling case for change and investment. This film highlights some of the Commission's proposals that are critical elements of this vision, supporting the goal of providing the people of England with world-class healthcare in the 21st century.
Everybody wants a nurse and a midwife that's compassionate and that cares. But actually, that's not enough. We also need a nurse and midwife with knowledge.
I see the role of education as being the engine for change.
Innovation in education and in research is actually about making sure that we don't just research on evidence that exists, that we look for ways of pushing the boundaries.
Research skills are highly important. We need to be able to practice out there for the benefit of the patient with evidence-based practice. I've had the opportunity to experience research within my dissertation, and that's widened my knowledge.
It's about nursing not sitting back on its laurels and saying it's okay, we're doing a good job. It's about whether we're talking about education, research or practice, we're looking ways to improve, to push forward. The Commission charges us to do that. Be brave enough to say what else could we do and how else could we do it better.
Whether one is a staff nurse or a director of nursing or a professor of nursing, they must adhere to the code of conduct, and the care of patients must always be their first and primary responsibility and priority.
Taking that to the next level, to directors' levels of nursing and midwifery, if they have to take responsibility for the quality of care and safety, well, then they also have to have the authority to make sure that no one cuts their workforce without going through them, and that all those discussions are at that level.
Prevention is important. Most people wouldn't want to be to the stage where they need to be treated, but if we can educate them about their health, and a lot of the questions that patients ask are, should we be changing our diet? What increases the risks? Being on this commission, I wanted to see the voice of the nurse being more prominent, and by doing that, therefore, they could set an example about health.
I think midwives have a pivotal role in making sure that women are educated to ensure that they have healthier lifestyles, have healthier babies, have healthier outcomes during their pregnancy.
Nurses can help reduce these diseases by setting an example, by being healthy, by, looking at their well-being.
So as midwives, we should walk the walk and talk the talk.
If we take the ward sister, that role is pivotal. Strengthening that role is absolutely paramount to the future safety of quality of care.
In many places, ward sisters and charge nurses already have a very high degree of authority and responsibility and a great deal of respect. However, this needs to be universal across the whole of the NHS.
I think the role of the ward sister is a pivotal role in terms of making sure that there is a quality agenda for the patients. They talk to the customers more frequently than we do. They are in touch with all sorts of blocks to service provision. They can tell us ideas about how you make things better. They are in touch on a daily basis, and I think that's crucial to service delivery.
In relation to the bad press that nursing and midwifery is receiving at the moment, or has done in the past, I think it's a big challenge but also an opportunity for us.
And if there was any time whereby nurses needed to really lead from the front, it's now.
Bad news travels fastest. We hear when things go wrong, but equally every nurse and every midwife, and I'm sure every patient, can give equally stories of how nursing and midwives have actually helped them. We have to listen to patients and accept where we've made mistakes, but we also have to make sure that the patients or the public at large know the positive stories about the good work that we do, because both are equally important.
I've been a nurse for almost 30 years. I've found it the most rewarding and varied career I could possibly have imagined. I think it would be brilliant if we saw more people choosing nursing or midwifery as a career of first choice.
We've got to make the profession attractive. People have got to see that they can have a unique career, and you can major in clinical practice, education, research or management. And there are probably very few professions that can give you that breadth of experience and opportunity.
Nurses and midwives all across England are working hard every day to build the backbone of world-class healthcare. This commission recognises these hard-working contributions, but also highlights things that need to change and evolve as our economy and healthcare needs shift. Regardless of your position, whether you're a nurse, a midwife or a chief executive, your attention to the issues and recommendations raised by the commission is vital to the future of healthcare in this country.